Dr. Amalur Ponathan. I am a member of State Planning Commission, and it's such a pleasure to be in this roundtable discussing options for treating cancer patients. Now, to put things in perspective, Tamil Nadu has 5.4% of India's population, but it has got 6.4% of cancer incidence. So the cancer incidence is very high relative to population in Tamil Nadu, and that bothers everyone, most of all Tamil Nadu government. So Tamil Nadu government has started a cancer screening program in a massive way, including early diagnosis, treatment and palliation, etc. They have issued a separate government order for that. Having said that, it's not just the government alone. As the conference theme says, it is equitable access through sustainable finance. Equity comes first, which means everyone, irrespective of their financial status, must get the best care possible in Tamil Nadu. That's number one. Number two is sustainable. If you start something and leave after 2-3 years, it doesn't make any sense at all. So we are discussing two crucial themes. One, equity. Two, how to make it sustainable. To make this program successful, we need the support of private players in a major way. Without private players, we cannot confront this major challenge, the 6.4% of the population having tumors. So we are through this day deliberating how to marry private sector and its goals with the goals of Tamil Nadu government, especially health department, in tackling this major challenge of cancer. And I am very sure very soon we will have a very profitable and happy partnership where people are taken care of irrespective of their income status, and the best treatment is offered to them. Thank you.
So with respect to screening, how government is going to improve, because early detection is key for the cancer.
So as I said, in public health, the first thing is screening by paramedical workers. So Tamil Nadu government has a very good Makkalai Thedi Maruthuvam program, and so far we have screened around 2 to 2.3 crores of people. That comes to 1/3 of population, especially more than who are above 40. So I think over 40 to 50, almost all of them are screened and early cases are detected. And once patients complain of some symptoms, they are immediately referred to the next available PHC or Taluk hospital or district hospital or even teaching medical hospital. As you know, today every district has a medical college, government medical college, where the best of the treatment is available absolutely free, no questions asked. So even with smallest doubt, the health worker refers the patient to the highest medical center, teaching medical college. So that's how the system works, and it has shown tremendous results, and especially non-communicable diseases like diabetes and hypertension and cervical cancer. You know, we have a very, very methodical way. So we have a very, very scientific, methodical way to test two crucial cancers for women: cancer cervix and cancer breast. We have very good program where every woman is screened for breast cancer and cervical cancer at least once a year. And treatment options are started very, very early for these two cancers. Third, we have gone one step further. We are one of the few states in the country where we have started HPV vaccination for women, so that not only cervical cancer, but even head and neck cancers, squamous cell carcinomas, can be prevented in a large way using this vaccination. This vaccination is getting good reception in public, and we hope to cover the total vulnerable population very soon. Thank you.
Thank you, sir.
Thank you.
Dr. Subramanian, senior most medical oncologist of India. I started the Department of Medical Oncology in Madras Medical College in 1971, and I started the PG course in Madras Medical College in 1996, and we have more than 100 medical oncologists coming out of Madras Medical College. Tamil Nadu has the maximum number of medical oncologists in India. So as far as personnel is concerned, Tamil Nadu is well served as far as medical oncology. And Tamil Nadu started the first radiotherapy department in 1915, and the second machine in the world came to Madras Medical College. So as far as radiotherapy also, Tamil Nadu is well served. And we have started the surgical oncology long back, and we have many surgical oncologists available. So as far as oncologists concerned, in the field of medicine, surgery and radiation, we have enough people. The emphasis should be on cancer prevention. So health education is very important. The government should do camps as well as through the media, TV, YouTubes and cinema, educating the public about the ill effects of cancer and how to prevent it. So healthy living, avoiding tobacco and alcohol, and consumption of fruits and vegetables, and exercise is very important. Secondly, cancer cervix is a major problem in women that can be prevented by vaccination. So all women before marriage, after the age of 9, should have this vaccination. Another aspect is secondary prevention. Secondary prevention means early diagnosis. When we diagnose cancer early, we are able to cure the condition completely with full restoration of health. For this, we should have awareness. And women should have periodic mammograms and pap smear, so that the two major illnesses of women, cervical cancer and breast cancer, can be tackled at the very early stage. And the common cancers like throat cancer, lung cancer, prostate cancer, colon cancer, and foot pipe cancer and stomach cancer can be diagnosed in the very early stage with a periodic camps and health education. So this is important. Third aspect I would like to emphasize is to improve the infrastructure of the government medical colleges. The pathology department is very important to diagnose cancer. So the pathologist should be given a training in oncopathology, and we can make use of our hospital pathology as well as Cancer Institute, Apollo Hospital and CMC Vellore for training of pathologists in oncology. And immunotherapy labs, genetic labs should be developed in at least 5 centers in Tamil Nadu, so that all cancers can be subdiagnosed and precision treatment can be given. And another aspect of diagnosis is PET scans. All districts should have one PET scan so that people can have the benefit of diagnosis and staging of cancer. Coming to the treatment, my personal feeling is to form a committee of oncologists headed by the Professor of Medical Oncology, Madras Medical College, and they should form the protocols. Just like we have ESMO guidelines, NCCN guidelines, we should have Tamil Nadu Comprehensive Cancer Network. And this will guide all the oncologists in the state how to go about by treating various types of cancer.
Highlights about this, highlights and benefits about this event, the conference.
This cancer definitely is helping in the sense that we have a collaboration with the pharma company, and once the government has a MOU with these foreign companies, we can get drugs at a much cheaper rate, and people can be benefited by the innovative newer drugs at a cheaper price. And that way, this conference is going to help to get a close cooperation with the government and the pharma.
Happy morning. I'm Bharat representing Guidance Tamil Nadu. So wonderful to have this oncology conclave in Chennai, and we've been discussing about multiple aspects, right from screening, diagnosis, patient care. Then there is about pharma industry which can support us, and also about palliative care as the 5 pillars on which our state is very strongly focused. Our state is very good at screening and early diagnosis, and I think there are a lot more work which can be done there. I think we are broadening our scope with industry partners to improve multiple facets of it to fight this endemic of cancer. In this initiative, the state has proposed an idea of high-end genomic laboratory to make sure that high-end R&D and other kinds of treatments are become accessible not only to the affluent population in the city, but also to the other part where we make it equitable solutions across the state for public and private hospital infrastructures. And we are also looking at establishing state-of-the-art R&D in Chennai for biotechnology and life sciences, where cancer will be a very important part across a 360-degree perspective to make sure that we fight this endemic together in a successful manner. This is an important conference to bring all our folks together, right from the government, then there is about private hospitals, then there are about industry leaders, which is AstraZeneca and Pfizer, then we are talking about NGOs who come together on fighting this endemic in different stages and different parts. And I think we have to work on a chariot model where all the horses and wheels run in the same direction to make sure that Tamil Nadu, along with India, leads this race towards solutions for cancer. Thank you.
Hi, I am Nilesh Pense, the Director of Oncology for Pfizer in India. I think it is a wonderful conference and the conceptualization of it by FICCI. We are very happy and proud partners in this journey, a journey of hope for cancer and oncology patients in Tamil Nadu. I think Tamil Nadu as a state is already on the right path with some of the best in class infrastructure facilities for oncology and cancer patients. As a group of physicians, policymakers, industry partners, patient groups, the conference is really bringing together some of the views which will help the decision makers take this ahead in a manner which will propel the cancer care in Tamil Nadu to the next level and make it the state which will remain the best in class, not just in India, but perhaps even in Asia and rest of the world. So extremely happy and looking forward to how the journey unfolds from this conference.